Welcome to Psych Talk. I'm your host, Dr. Jessica Rabin, a licensed clinical psychologist. If you are a mental health professional, student in the social science field, or just interested in psychology and mental health, this podcast is for you. Although topics discussed on this podcast are similar to therapy, Psych Talk is not a replacement for therapy and is for educational and entertainment purposes only. So let's dive into today's episode. Hey everyone, welcome back to Psych Talk, and thank you so much for joining me for today's episode. Today I have a very special guest with me, Destiny Davis, who is a licensed professional counselor and certified rehabilitation counselor. So Destiny, thank you so much for being here today.
Thanks for having me.
So I am super excited for our conversation because it's a topic both of us are very passionate about. But before we dive into our conversation, can you introduce yourself, a little bit
Yeah.
about your background and what you do, and anything else you want to share?
Yes, thank you. So I'm Destiny Davis. I practice in Atlanta, Georgia. I have a private practice here, a podcast, the Chronic Illness Therapist podcast, and am hosting a conference in March that I'm really excited about for other therapists who specialize in this work as well. And yeah, it's everything I do. All of my clients have some type of chronic illness. We're working through anxiety related to chronic illness, not chronic illness caused by anxiety. 'Cause that's a whole thing.
Mm-hmm.
And so, yeah, lots of like helping people just figure out how to communicate when they're ill, how to ask for what they need, and how to kind of learn to live life as normally for themselves as possible, despite, having things that well, it's interesting because 76% of our country has at least one chronic illness. So
Yep.
it's just a little interesting that we still feel so siloed and alone in it.
Mhm.
But literally three-quarters of the country has one. So there's that.
Yeah. Yeah. So how did you come to specialize in chronic illness, medical trauma as well? Because I know that's something else we're going to be talking about today. Do you
Mhm.
mind sharing a little bit about your
Yeah.
journey?
Yeah. I watched my mom sick my whole life, and everybody telling her she was a hypochondriac. So I kind of grew up with that like vernacular, that language. And then I got older and I started having the same kind of like symptoms that she had, and I was like, oh no, like, and what am I supposed to do? I can't, if doctors dismissed her whole life, like they're not going to help me. So I just kind of dealt with it for a long time. And then eventually I just started realizing like the stress of living with something that people can't name is really hard. And I knew I wanted to be a therapist. And so I actually knew in grad school that this would be my specialty. And I made sure all my classes, all my papers, everything was around this. And then my master's was in rehabilitation counseling. So a lot of people don't really know about CRCs, but we are trained in disability studies. We understand like how to help people with disabilities gain, regain, or maintain employment. So
Mhm.
it's like a heavy focus on employment while living with a disability. And so that was, yeah, now I just have the lived experience from kind of secondhand as well as personal, and then the professional research around it as well.
I love that. Thank you so much for sharing. And full transparency, I didn't fully know what rehabilitation counseling was either.
Yeah.
And in my mind, I was like, okay, like, we have rehabilitation psychologists, like psychologists that work in rehabs, but a
Yeah.
lot of them have like doctorates in
Mhm.
clinical or health psychology, like not
Yeah.
necessarily rehabilitation. So that's so interesting because, yeah,
Yeah.
the disability aspect, and we might touch on that at some point in our conversation, is
Yeah.
huge, especially when people want to work, have the ability to work, and their chronic illness limits that ability or doesn't allow them to work to their full potential. So I love that there's that field out there.
Yeah, that's exactly right. I'm glad you mentioned that. Most people do want to work. And even if they don't, there's so many different roles that we get to play in society. Um, it's just, yeah, the topic of employment is just such an interesting one.
Mhm.
Not everybody needs to have a 9 to 5 or, something that brings in monetary income.
Mhm.
There's so many roles that we get to play in this society. If society just allowed for that to be the case, it could function just fine. So it's a topic that I'm pretty passionate about.
Hmm. I love that. So today's discussion is primarily going to focus on both medical trauma and chronic illness. And, they are pretty interconnected. They're not the same. I know we've already started talking a little bit about chronic illness, and we'll dive deeper into that later in our discussion. But I wanted to start with medical trauma. And one thing I love to do on this podcast is define for listeners what we're talking about so we're all on the same page. So, can you start the discussion by defining for listeners what medical trauma is or how you would define medical trauma?
Yeah, medical trauma is really it's a psychological and emotional harm that happens through malada or through healthcare experiences that are just they're not what you needed or they're overtly harmful. I really
Hmm.
like to add in that piece. Sometimes people don't really resonate with the term medical trauma because they're like, nothing bad has ever happened to me, but there's so much that should have happened to you that didn't. Um,
Hmm.
so they didn't get the answers that they needed. They didn't get I'm so sorry, we're going to figure this out together. Instead, they got like, well, your labs look fine, so you should feel fine.
Hmm.
And that all contributes to medical trauma, traumatic medical experiences. And um, another definition that I sometimes like to throw around is Peter Levine's definition of trauma is basically anything that's happened too fast or too much for your nervous system. And so even just the act of going into a medical office and there's a doctor coming in and spending 3, 4 minutes with you. Sometimes we say 7, and I'm like, even that seems gracious sometimes. It's like 3 or 4 minutes, and they have
Hmm.
their really quick, you know, questions, and your brain might not be moving that fast. And so that in and of itself is an experience that leaves you feeling confused and unfinished and
Hmm.
unresolved, and all of that time after time after time after time leads to that traumatic experience inside.
Hmm. I love that definition. Thank you so much for sharing because I agree. I think a lot of people, don't resonate with the term medical trauma, or they are like, well, this bad drastic thing didn't happen to
Hmm.
me. Like a doctor didn't leave an instrument in my stomach while doing
Exactly.
surgery, or like, I don't know, something
Yep.
that they think is like extremely traumatic. I didn't almost die. Like I hear
Yeah.
that a lot
Yeah.
as someone that works in a hospital. Like, well, I didn't almost die, but like I don't
Yes.
understand why I'm scared. But to your point of like not getting answers or even just like feeling invalidated, but obviously like you just said like time after time again, like if you're I'm thinking of your mom and what you
Yeah.
shared, like
Yeah.
if she was dismissed her whole life not
Yep.
feeling heard. I don't know. I'm making this up.
Yeah.
You can tell me if this was not
Yeah.
her experience, but like
Yeah.
a lot of times people will then avoid going to
Yeah.
doctors, which,
Absolutely.
no,
I mean, that was
if,
what my experience was. I was like, I'm not going to go because
yeah.
why would I?
And then if there is something
Mhm.
wrong that can be treated,
Exactly.
you don't know because you're avoiding
Yeah.
the people that harmed you, which, if we're thinking about trauma, makes sense. Like you
Exactly.
don't want to go into the situation. So it's this like cycle of, you know, I had this or repeated negative experiences, and now I'm avoiding those negative experiences, but my symptoms are still getting worse and I don't have answers. And, I have a lot of people that have told me like they are made to feel like they're crazy.
Yeah.
And I don't use that term lightly. Like, I don't
Yeah.
love the word crazy,
Yeah.
but like, I know what I'm experiencing. But like you said, the doctor said my labs are fine
Exactly.
and I
Yeah.
don't feel fine. But
Yep.
if everything's coming out fine, I must be fine. Is it all in my head? That's something else I hear a lot. Like, is it all in
Yeah.
my head?
Even after they get their diagnosis, it's still the same. That comes up all the time. Like, yeah, but like, is it really that bad? And
Hmm.
maybe we can define what a dynamic disability is as well. And
Go ahead. Yeah.
that's, this when your symptoms fluctuate. And
Hmm.
so one day I was just telling you as we got on, like, I'm feeling very potsy today. I'm kind of woozy and my head is like, there's pressure in my head. I could feel my heartbeat in my head. And also, as I sat down for 5 minutes trying to like that, those symptoms kind of went down. I'm like, okay, feeling a little bit more regulated. And that ebbs and flows. And sometimes there's reason for it, like anxiety can exacerbate these things. And sometimes there's no reason at all that you can really think of or that you had any control of.
Mm-hmm.
Um, I think there's always a biological reason somewhere in the body, but sometimes it's just nothing you had control over. So dynamic disability is one in which it's often unpredictable, although some of the work that I do with clients a lot is learning how to kind of figure out what symptoms mean something is
Mm-hmm.
happening later. So you can't predict like, oh, Saturday, yeah, I'm going to be feeling this way.
Yeah.
But if you have like a consistent job and you know how you feel at the end of one day of working versus 5 days of working, then
Mm-hmm.
you might know that Saturday you're going to
Yeah.
be out of condition, out of commission. So yeah, these dynamic disabilities. It's interesting because even wheelchair users will sometimes be able to walk, and so that will be a dynamic disability. And they also will struggle with this so much. It breaks my heart because I have worked with so many clients now who have gained such a quality of life from getting a wheelchair.
Mm-hmm.
And the hardest part of that is when they feel like they are, um, that maybe they are making it up because they can walk.
Mm-hmm.
And it's just, yeah, it's difficult when you're in that seat, especially if your family around you doesn't get it and
Yeah.
you barely get it. So it's like, how do I educate when I barely get it? And it can be really hard.
Oh, absolutely. And I know we're talking a lot about medical trauma, but to one reason I love podcasting and talking to people is I think of things when we're having conversation, but you just mentioned like family systems. So like you can have medical trauma, whether that be a near-death experience, whether that be in a constant invalidation, not getting answers, things like that. And then if your family system or your friends around you don't understand either, whatever that medical trauma is, or maybe it's your chronic illness, um, that can be traumatic within itself, especially with those dynamic disabilities. I mean, I work with a lot of individuals that have MS, and a lot of them have the remitting relapsing. So there are times that they are fully functioning,
Yeah.
like you wouldn't know, and then suddenly
Boom.
they're unable to walk.
Mm-hmm. Yeah.
And, especially the teenage girls I work with, a lot of times they're like, kids at my school don't understand. Or they're like, well, you were just walking the other day. Why do you need a wheelchair now? And it's like that compounding trauma.
Compounding, for sure.
Um, and if people don't want to label it trauma, but just disenfranchisement or whatever you
Mhm.
want to label it, it compounds. And we'll get into the impact on mental health here shortly, but
Yeah.
obviously impacts mental health.
Yeah, absolutely. Yeah. And you're right that you can really use so many different terms for whatever resonates with the client. But yeah, it's disenfranchising. It's to live in a world in which it's one thing to live in a world in which maybe not everything is fully set up for you. And then it's this added layer where not everything is set up in a way that you can navigate it, and the people around you refuse to help
Hmm.
in navigating that unnavigable world.
Yeah.
It is like layer after layer, and you really lose such a sense. There's no sense of trust sometimes in
Hmm.
yourself, sometimes in the people around you, in your body. Like trust is a big thing that we're working on in most sessions in one way or another, even if it's not explicit.
Hmm. Absolutely. So we've kind of already touched on different ways medical trauma um can happen, but I would love to hear if you can think of any other like clear examples or maybe examples you see of medical trauma, and then some signs and symptoms that one may experience after a medical trauma. Because clearly, as we've already discussed, it can be a wide range of things. So if someone is listening and they're like, okay, how do I even know if I experienced medical trauma?
Yeah, yeah. I think one of the key signs for medical trauma is really just a fear of going
Hmm.
to a doctor. And the trauma might even just be about how much the surprise bill was. So you don't, in the US anyway, you never know what your bill is going to be.
True.
Um, we're talking about the US here.
We are. Yes, we should have clarified that as we're talking about this conversation.
Totally.
Both
Right. This
based
is
in the
probably
US.
like, yeah. Um, and so yeah, the trauma can come just from that. And so the fear might not be when we're talking about fear and an individual being fearful and therefore avoiding treatment, there's no pathologizing there, meaning we're not
Hmm.
blaming the individual. I mean, some people do. I'm not.
Yeah.
Um, it makes total sense that you're really scared to go to the doctor, but that probably is indicative of medical trauma. And then we can work through that so that you can start to get the help that you need. And sometimes that looks like some mindset work, but for the
Hmm.
most part, it looks like finding different kinds of resources and opening their world up to parts of the world that they didn't know existed.
Hmm.
That's kind of the beauty of specializing in this work is if that's really, I've gained so much more knowledge about the medical system than I ever would have learned just going through it by myself because of
Hmm.
my own experience with like avoiding and the different paths I went down. I mean, I've learned so much from my clients, from the things that I do to kind of continue my education about the healthcare system. So
Hmm.
yeah, I would say that's kind of the key teller is that they're scared to go to the
Hmm.
doctor.
Yeah.
Um, and then I think some of the things around like how people's, we talked about grief and loss impacting their mental health. That's a really big one, of course.
Yeah.
There's the isolation, which we also touched on a little bit.
Hmm.
But I think one that is not talked a whole lot about is being constantly wrong, like living in a body that constantly gets
Hmm.
things wrong or in a body that constantly can't do things right. And then there is a really strong overlap with neurodivergence and chronic illness. For whatever reason, I'm not the neuroscientist, so I won't go down that path, but
Hmm.
um, you're constantly told that the way you're thinking is wrong or the way your body is feeling, it shouldn't be feeling that way.
Hmm.
It's very disorienting. You don't know who to, like I said, with trust, like you don't know who to
Hmm.
trust, and you certainly don't trust your own body. And then you kind of, and then I think that also leads to this experience that I see so much lately, which is like because the medical system doesn't understand the lived experience, now we don't trust anything in the medical system.
Hmm.
And that means like, yeah. And so you're feeling all these things. And I always tell clients like you are the expert of your own body and what it
Yep.
feels. But to
Yeah.
know what that feeling means, you need the medical expertise around that. And
Hmm.
it's very hard to find the doctor who's going to understand your particular set of symptoms. So it does take a lot of unfortunate and traumatic trial and error.
Hmm. Yeah. Going off that last thing you said about the unfortunate and traumatic trial and error, I've seen that a lot with my clients with various chronic illnesses.
Mhm.
And unfortunately, slash fortunately, depending on what way you look at it, I find often my patients, and I say patients, I always clarify this because I work in a hospital system.
Mhm.
When I talk about outpatient, I say clients. But
Yeah.
a lot of my patients will get answers quicker if they have to be admitted to the hospital. So if
Mhm.
their symptoms have gotten so severe, it
Yeah.
requires hospitalization because then you're getting all the tests run at once. You're getting all the subspecialists in at once. What we said, we're in the United States. Okay, one, hospital bills aren't cheap, but two, hospitalization itself can be
Yeah.
traumatic. But on the
Absolutely.
other hand, so like, yes, you might get a diagnosis quicker, but you had to go through this
Hmm.
traumatic, stressful experience to get there. On the other hand, my clients that say finally get a diagnosis on the outpatient side have spent typically years
Yeah.
going to different
Yep.
doctors, which can be its own traumatic or stressful experience
Yes.
within itself as well. Like, yeah, they didn't have to get this acute hospitalization with people poking, prodding them for a week straight, all these diagnostic tests, but all of those things were spread out over years. And
Yeah.
wait, oh, you get this specialist referral, and then you see them in 6 months because,
Yeah.
like,
And you're just
it's,
waiting, you're living in limbo. Absolutely.
yeah. Which, like we were saying, there can be so many different ways people can experience medical trauma. And so, one thing I want to say to the listeners, and it sounds like you want to say this too, like, use whatever term fits for you. But like, if you feel like something is traumatic, if you are avoiding
Mhm.
medical care because of that, if you are questioning trust within yourself or questioning how much you can trust providers like know that your feelings are valid. And if
Yeah,
the experience was traumatic for you, it was traumatic for you.
exactly. Yeah. Yeah, and then, your medical experiences get coupled with, and that's a term that we use a lot in somatic experiencing, which is one of the modalities that I'm trained in. It's not my main modality. It's more of this like, it's like the sprinkle on top of when I really mostly use acceptance and commitment therapy, but
Mhm.
um yeah, we it's called overcoupling, and it's just this idea that when two things happen at once, your brain or your nervous system now associates those two things as one thing. So
Mm-hmm.
anxiety mixed with pain, well, now we don't know how to differentiate the anxiety from the physical pain because they always happen together. And so in your brain, your body, your brain, it's one thing now,
Mm-hmm.
and we can slowly start to separate. That was like a huge eye opener for me in my own journey, was when I slowly started to separate what I was like mentally anxious about around something versus like a POTS flare up that was bringing my heart rate up.
Mm-hmm.
Yeah,
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 I love that you brought that up because this is something I talk about with my patients all the time because, and I don't know if there's actually data on this, and I would love to get your thoughts, but I have found just basically working with hundreds of people over the years that my clients with chronic illness that also struggle with anxiety, their anxiety often presents as a symptom of their chronic illness. So, like
yeah,
any of my patients that have GI issues,
yeah,
whatever their GI, Crohn's, things like that, often get stomach aches, stomach
yeah,
nausea, things like that. Exactly what you said, POTS,
yeah,
increased heart rate or dizziness.
yeah,
My chronic pain patients, if it's more of generalized pain or something else, it presents as pain or
yeah,
migraines. And
totally.
so the coupling, exactly like you talk about, and I validate my clients because it is hard to be like, okay, do I have a migraine because I have a migraine? Or is my head
Yeah,
hurting because I'm anxious? Or is
yeah,
it both? And oftentimes, especially with pain, but other conditions too, then it feeds off each other. Like I
exactly.
talk about the pain anxiety cycle. Okay.
Yeah,
Your stomach hurts and now you're anxious because you're wondering why your stomach hurts. But because your
yeah,
stomach, because now you're anxious, your pain perception has
exactly.
increased. Um,
Yeah, and a lot of times people don't even know, like, this happens a lot in session where someone will be like, I'm not scared of the pain. I've already done that work. And I'm like, it's not that you're consciously saying I'm scared of this pain, but through other questioning, I can tell that there is still a fear, a rightful, normal,
mhm,
natural anxiety about being in pain, because being in pain means I can't do everything on my to-do list. I won't get the help that I need. Don't know
mhm,
how long this is going to last. There's no answers for it. So there are a lot of anxieties that come along with the pain. And even if you've done some really great work around like, okay, I'm not gonna, have a full-blown panic
mhm,
about this, your nervous system is still rightfully responding to an unpleasant sensation in your body. And it's actually about learning to listen to that and be with it rather than trying to push it away
mhm,
and be like, no, I just don't, or, it's fine, I'm over it, or anything like that. It's much more, and that's again where the somatic work kind of comes in. It's about being with the pain or the sensation or the emotion, any of the kind of human experience. It's being with it without having a secondary reaction to it.
mhm.
And learning to do that work takes repeated exposure to the somatic, to the body sensation
Sensations. Mhm.
over and over and over again. It's not just a mindset thing.
Yeah. And
So,
that can be very uncomfortable within
yeah,
itself, having
totally.
to sit with the discomfort or pain,
Yeah.
whatever it is of the body sensations.
And I want to add too that we only do that work when someone has medical care,
Hmm.
and has actual treatment and answers,
Hmm.
um, to an extent. Like, not only there are some things that we can do somatically before somebody has a diagnosis, but you just want to be so, so, so clear that when you're talking about sitting with it, that doesn't mean sit with it, accept it, and don't do anything about it.
Yeah. Oh,
It,
absolutely.
It's totally like, you're still going to go to the doctors, you're going to get the labs, you're going to try to get answers. We're going to figure out like what is life-threatening.
Hmm.
This heart thing means, you could have a heart attack
Mm-hmm.
versus like this is, with POTS, like we know, I'm trying to think if there are any examples that are more extreme than this, but we know that like the rapid heartbeat is not a heart attack happening.
Mm-hmm.
We can calm that down through breath and through feeling secure and having someone hold our hand. And
Mm-hmm.
that's I think another important thing to, as we're talking about what therapy can look like for this. It's not just, it's for me, it's almost never about mindset. The mindset is just one tiny little piece that gets connected to what support systems do you have around you. Again, like, can somebody hold your hand? You're not meant to just calm your fear down on your own.
Mm-hmm.
Um, and sometimes it's just my voice. Sometimes that's all people have until we get them the right support outside of therapy. So in the very beginning, sometimes it's quite literally just my voice and the validation that I'm providing in session. Once they have a strong sense of, wait, yeah, that does feel good and it does calm my nervous system down when you say this and when your voice sounds like that, now we can start to, okay, where can you find that outside of session? How do you build a support system that's not gaslighting you, dismissing
Mm-hmm.
you, and is helpful?
Mm-hmm. I love what you said about like kind of differentiating what is a crisis or an emergency. I can't remember the exact word you use
Yeah.
versus like what is my symptoms. And that's something I talk about with my patients a lot too, because, a lot of times working in a hospital, I see them in the hospital because of some type of symptom related to their chronic illness that caused an alarm of some sort. Because, yeah, if you have like chest pain, that's really scary. Is it a heart
Yeah.
attack? Is it a panic attack? But if you have, like, say, a chronic illness of some sort, especially a heart related chronic illness, obviously you're going to be like, I need to go to the ER. And a lot of times the ER is like, oh, since you have this cardiac history, let's admit you. And I bring that all up to say, like, a lot of work I do is like figuring out like a plan. Like, okay, what are the bodily
Yes.
signs and symptoms that you do need to maybe seek medical care? Okay, what level of medical care? Is that an ER? Is it um going to like just sending a my chart message
Yeah.
to the nurse to go over your symptoms? Is it a phone call? Is it something that we can, you know, make a I'm thinking a lot of pain because I do a lot of pain, but pain
Yeah.
plan for, okay, so this is the first line of medication you take. These are the behavioral interventions we did. And then what
Yeah.
is it? Because in that moment when you're having a lot of symptoms, it's hard to like think because you're like, oh my
Totally.
gosh,
Yeah.
my heart rate's through the roof.
Yep.
I'm gonna die.
Yep.
Like, I mean, like, that's what your
Yep.
mind
Yeah.
does.
And for some people, having that plan on paper is enough. And I always want to speak to the people who like feel like that's not enough.
Mhm.
That's where you're so like you might need somebody else to even just read the paper to you. You
Yeah.
might know exactly what's on it. You might even be able to recite it from memory. And just having somebody else who's a trusted family or friend or somebody trusted,
Mhm.
um, that can be really helpful. Like if they just even read it to you, their voice would be the thing that calmed you down or to help you trust that what's on the paper is legitimate.
Is yeah, I love that. So I realized I probably should have asked this earlier because we've been talking about various chronic illnesses. I think we've talked about POTS. I mentioned like Crohn's, pain disorders, and
Yeah.
you gave the statistics that pretty much what
Yeah.
you said 76%, right?
Yeah.
So
Yeah.
three-quarters of individuals in the United States live with a chronic illness.
Yeah.
Can you define for listeners what a chronic illness is? I think everybody
Yeah.
probably knows, but it's
Yeah.
also important for us to define
Totally.
that.
Yes. Yeah. It's really anything that's lasts longer than 3 months. So, I mean, it kind of really, I mean, especially with long COVID now, I think, I don't know if
Yeah.
that's what drove the number up
Yeah.
or what, but we just diagnosed a lot better than we used to. But yeah, it's anything that lasts longer than 3 months.
Mhm.
And it takes an average of 7 to 10 years to get a diagnosis. So, I mean, there's that.
Which we mentioned, but also going back to medical trauma, like
Mhm.
if imagine, like, I don't know, for anybody listening that maybe doesn't have a chronic illness, like imagine experiencing symptoms for 3 months,
Yeah.
but then it takes 9 years and 8 more months I was trying to
Yeah.
do math in my head
I
to get a
know.
diagnosis.
Yeah, yeah,
Like,
exactly. And during that time, sometimes your symptoms go away, sometimes they feel
mhm.
better, sometimes they feel extreme. I mean, even to the point where like, even with dermatologists sometimes, like a picture isn't enough for them. They like need you in the office during a rash flare up. And it's like, I mean, I get it. They might need a
Yeah.
biopsy, but also we need better systems because
Hmm.
it takes, like you said, 3 months to get in anyway.
Yeah. Like you can't just be like, okay, yes, I will schedule my rash for
Yeah,
March 14th. I'm gonna look at
exactly.
it. Like, yeah. Well,
Yeah,
and I think that goes to what we were talking about too with the invalidation, because like maybe by the time you get with a specialist, you're like, actually, my bilateral knee pain hasn't been bothering me.
yeah,
And they're like,
exactly.
okay, well,
Yeah, yep.
we'll
They're like,
make
great,
come
okay,
back when it does, or you're done.
yep,
Yeah, you're done. Call us if
exactly.
it comes back. You 2 weeks later, it starts again. Okay, now you're an established patient, so you might get in a little quicker, but they're like, hey, our next appointment is 3 weeks from now.
Exactly.
What?
Yeah.
Yeah.
Yeah, and there's no education either. The most you might get is write down your symptoms for me. Like there's no questions. When you have joint pain, does it also co-occur with this? Does it,
Mhm.
they don't know how, or they don't have the time, and because they are
Mhm.
also screwed by the system
Oh, absolutely.
so very much. But ideally, their questions that they use to rule things out should be asked to the client, to the patients,
Hmm.
you know. But I think it stays internal in their head because they're just trying to move so fast. And so it's just a really faulty system.
I was about to say this could have been a whole separate podcast episode
Yeah,
of like how at least the American healthcare system
yeah,
fails individuals with chronic illness and those treating the
totally.
individuals with chronic illness.
Yes. Yes.
So we've already kind of touched on this as well, but I wanted to make sure we have like dedicated time to it. The connection between chronic illness and mental health.
Hmm.
So
Yes.
I'll let you take that wherever.
That's a tricky one because I mean, yeah, for one, we have a lot of great data like the ACEs study and to kind of show that when you have a rougher childhood, more adverse childhood experiences, in other words, traumatic childhood experiences, you are more likely to develop a chronic illness. And so I think that has also led its way into the world of if you cure your trauma, then you'll cure your chronic illness. And I
Okay,
always like
yeah.
to say to people, even if the constant heightened cortisol as a kid contributed and probably did contribute
Yeah.
to the development of this condition, talk therapy, breath work, psilocybin, none of it is going to just cure
Hmm.
your chronic illness. There was years of I don't always like to use the word damage, but sometimes I think it is the word that to use. Like there's years of damage that's happened, and now our job, yes, there are things that you can do to revert to manage pain,
Yep.
sometimes even reverse it. But most people, I mean, I work with a lot of people who have gone through all of the everything from like all the Western stuff and all the
Hmm.
like holistic stuff.
Yeah.
And they realize that on the other side, the holistic stuff is full of, holes, just like Western
Hmm.
medicine. And they are still in pain at the end of the day. And that doesn't mean that they're in the work. Like when I started this journey, I mean, I've talked about this openly before. I started in like the holistic world because of my
Okay.
experience with my mom. I was like, Western doctors don't listen. I found myself at a school that just so happened to have a chiropractic college attached to it.
Oh,
And so
wow. Okay.
I was kind of immersed in that world.
Hmm.
And truly, like, you couldn't even touch my wrist without me jumping off the table. It was so painful. Like,
Oh my
it
gosh. Okay.
felt like you were like chopping my wrist off. It was awful. And that chiropractor worked with me for like 3 or 4 years. And whether it was their chiropractic adjustments, probably not. It was probably more the relationship and the learning to slowly build trust in my body again over time that
Hmm.
really did it for me. But yeah, I still have a lot of pain today. I still have lots of things going on. And also, like, you can touch my when I have that same level of actually I never have that same level of joint pain anymore. But when I do have pain that's kind of reminiscent of those days, I know exactly how to handle it in a very automatic way. Like it's
Hmm.
so subconscious now because I've been practicing it for 10 years.
Yeah.
So, for example, a lot of people with chronic pain brace and they hold their breath a lot
Yep.
just through practicing deep breathing 10 plus years ago. That was hard at first. Like the first time I ever laid down to do deep breathing, I took 3 breaths and I thought I was going to throw up. Now I kind of see that as like, yeah, my diaphragm was so weak, it was like as if I did 100 reps of squats at the gym or something. And like it was literally like that.
Wow.
And so but I knew so much about the body. I think
Hmm.
psychoeducation about, or education about the body is so important because it can reduce some of that fear as well.
Yeah.
And I knew that at the time. I was like, wow, my diaphragm must be really weak. Like I actually have to keep doing this.
Yeah.
Whereas some people get really scared and they're like, no, it hurts too much or it's too uncomfortable. And this means like it's bad.
Hmm.
That's where some of that, it's not, again, it's not really mindset. It's actually just knowledge of the body.
Yeah.
Like if you don't know how the diaphragm works and no fault of your own, no one taught you, you didn't go to school for, PT or chiropractic or
Mhm.
whatever, then you don't know how it works and that's okay. So you're fearful of it. And to have professionals who can teach you about the body in a way that's non-pathologizing, doesn't make you feel stupid, doesn't make you feel like you're just anxious and that's why you're in pain, all of that can contribute to, you know, I hate the word healing, but it's because again,
Yeah.
like I still live with chronic pain,
Yeah.
but now like that was kind of the main point I was making was I would brace like most
Yeah.
people with chronic pain. And now it's like as soon as I feel certain pain in my body, I immediately deepen my breath. And there's a little bit of a conscious effort there, but it's so much in the background now because I've been doing it for so long.
Mhm.
It really is more of an automatic behavior. And so I'll deepen my breath. I'll like tighten up my abs. That's like a part of what I have to do for my body. Everyone's body is different. But
Mhm.
I think it was helpful for me to hear examples like this when I was going through it. And so that's why I
Yeah.
like to share specific examples as well.
Yeah. Oh, absolutely. And I think what you highlighted there too is like you started with the ACEs. So, you know,
Hmm.
negative life experiences, poor mental health can lead to or is correlated with chronic illness. I mean,
Yeah.
I guess.
Yeah.
Um,
That's right.
we've obviously talked the opposite is true. Having like pain disorders can
Yeah.
cause increased anxiety. You mentioned like isolation earlier. We
Mhm.
haven't explicitly said depression, but
Yeah.
depression is. And the other aspect of that too is with the right supports, your mental health can get better, even
Yeah.
if you're continuing to live with a chronic illness and you learn to
Absolutely.
manage your symptoms. But, if you're not panicking when you're taking the deep breath for diaphragmatic
Hmm.
breathing anymore, if you're training your body, um, so, like, yeah, chronic illness does impact your mental health impacts your chronic illness, and both can also get better
Yeah.
together. Um,
Absolutely.
but not in the sense of you heal your trauma and suddenly your
Yeah.
cardiovascular disease. I mean,
Exactly.
lifestyle changes
Exactly.
may lessen the risk, but yes, like, yeah,
Exactly.
it's not a one-to-one ratio.
Right. And I know that they're doing so much research right now. Thankfully, I'm so thankful for the research being done right now. Even I don't know how political you get on this podcast, but
That's
despite what
fine.
the administration is
Oh,
doing,
you're allowed to say that. That's fine.
okay. Great. Despite that, there's still really great research going
Yeah.
on, despite all the defunding. And so there is a lot of research that's talking about when certain somatic practices are done, like whether that's just deep breathing. I think that's the
Hmm.
other thing. We didn't define somatic. Somatic is just of the body.
Yeah.
Um, and it sounds so fancy, but it literally could be just taking a deep breath. That can be
Hmm.
somatic work. That is
Yeah.
somatic work. And that in and of itself can have a physiological positive immune response in your body,
Hmm.
right? So there are physical things that happen when you are like engaging in some of these practices, just like these things can happen when you are, working out joyfully, not
Hmm.
working out hating it,
Yeah.
or being with friends also has if it's a good, happy, fun, stress-free environment, that also would have a positive impact on your immune response. But we don't research it in that way. We tend to
Hmm.
research it like, this variable here
Yeah.
and so which is important, but I just think it's also important to note that it's not like somatic work is this magic cure for your immune system. It's about resources, it's about living a life not just like mentally not being scared of things, but living a
Hmm.
life that doesn't cause you to be scared of things.
Yeah.
Um, just being scared of losing your job because of all of what's happening right now, defunding, being scared of my best friend in the whole world is terrified of ICE because she's Puerto Rican and
Hmm.
um, born here, but it doesn't
Yeah.
matter. So those things really contribute to nervous system dysregulation. Those are the main drivers of nervous system
Yeah.
dysregulation. I even like that you mentioned, it's a link between between trauma and chronic illness, the ACEs study. And I would even think, again, growing up with my own childhood, my mom had these medical conditions and could not be the mother that she probably could have been if she
Hmm.
wasn't bogged down by these,
Yeah.
I mean, severe, severe pain on a daily basis. So
Hmm.
it's all interconnected, and people
Absolutely.
really like to isolate to kind of have this easy like treatment protocol, and it's just not that easy.
Oh, absolutely. I tell people all the time, I wouldn't have a job in a hospital if our mind and body wasn't connected. Like as a psychologist, like
Yeah,
I wouldn't, there
yeah,
would be no need for me if our mind and body isn't
totally.
connected. And then you add in things like external stressors, sociopolitical climate. Um, you just shared your mother, because of her own things, couldn't show up for you in
Exactly.
the way she probably wanted to, and who knows how
Yeah.
that impacted you. I'm not asking you to dive
Yeah,
into
yeah,
that.
yeah, yeah,
But like it
yeah.
all is, and I mean, and that goes back to stuff we were talking about earlier with just like um your masters and like
Hmm.
disability and jobs and things like that. If you're having a flare and your job is not understanding, and then you don't have PTO and they fire you, then you have financial stress, and the financial stress is going to impact your nervous system and maybe cause more pain or
Yeah,
whatever it is. And yeah,
yeah,
it's all interconnected.
exactly. We did a colleague and I did a workshop a few weeks ago around countertransference and chronic illness, and being a therapist with a chronic illness who also specializes in it. And um, I was just like almost speechless, but there was somebody who asked a question in the chat of like, um, is it okay? Like, I'm scared to ever disclose because if the board finds out, then I might lose my license. And I don't know how would imagine this person probably was older because I feel like that's a much older rhetoric,
Yeah.
but
Oh my
that's
gosh.
how it was. Yeah, I'm like, you and I are like, that's not the case anymore. We have ADA
No.
laws. We have
Yeah.
like I'm very open about everything.
Yeah.
Like, um, we have ADA laws now. Maybe there are some conditions, if you have dementia, you
Oh,
probably cannot do this work anymore.
yeah.
There for sure are conditions, but um, I think the fear around just having a chronic illness, like one, I think it is definitely better today than it ever was before. And I'm so
Hmm.
sorry to anybody with trauma from today, because I know that might feel really invalidating, but like it's not meant to be. It's just we do
Hmm.
have to realize where we've come from, how far we've
Yeah,
in order to even know how far we still have left to go. So,
absolutely.
yeah.
Yeah. So you have given so many beautiful examples of somatic work that you do with clients, but you also mentioned earlier that's actually not your primary
Yeah,
modality, and you
it's
use
true.
acceptance and commitment therapy. So I wanted to give you some time to talk about like
Sure.
how acceptance and commitment therapy can be beneficial for
Yeah,
those who have experienced medical trauma or chronic illness, since that's the modality you apparently use more than somatic
I know.
experiencing, even though we've been talking about somatics
I know.
throughout this
I
whole
thought about
episode.
that as I was talking. I was like, dang, I really did say that a lot.
No, that's
But
fine.
it's funny because I'll get people sometimes with a consult call and they'll be like, I've tried talk therapy. I want somatic work. And I'm like, well, actually, what we do sounds more like talk therapy. And I practice acceptance and commitment therapy. Um, acceptance and commitment therapy is really big on helping clients understand what their values are and then making
Mm-hmm.
choices from a place of what you want in life rather than from a place of what you don't want.
Mm-hmm.
So an example might be, I'm gonna lay in bed because I'm so scared that if I don't, then I will be no good to my family.
Mm-hmm.
That's a fear-based decision.
Yep.
Whereas a values-based decision is I value being able to show up for my family, or I value health and wellness. And so I'm going to do this thing that is in alignment with that value, which is rest.
Yeah.
And so we're just always looking towards, not always, but we're mostly looking toward what it is we want rather than like what it is we don't want.
Don't want. Mm-hmm. Yeah. I love that so much. I share this story a lot. I don't know if I've ever shared it on the podcast, but like years and years ago, it was probably 7 years ago. And I love all the physicians I work with, and they're always told that CBT is the only mental health treatment there is.
I
And it's
know.
become a running joke. But years ago, I had this client, I won't give details, but one of the physicians was like, "So you like do CBT with him?" And I was like, "Absolutely not." And
Yeah.
he was like, "What?" And I was like, no, I'm actually taking like an acceptance and commitment therapy approach because there's a lot about his situation that he can't change. And we did values work and things like that. And he was like, what is that? And so then I had to like create like this presentation on
Yeah.
different interventions. But I have also found that ACT, acceptance and commitment therapy, is very beneficial um, for my clients with chronic illness, with medical trauma. I do a lot of values-based work, but also like you've talked a lot throughout this episode of like the mindset work. And I've gotten feedback from a lot of clients that the CBT, like challenging the thoughts, can
Hmm.
actually be invalidating
Yeah.
because they're like, well, I still have this chronic illness, or I'm still in
Yeah.
pain, or whatever it is. I still have to use a wheelchair. Um, where
Yeah.
the like values driven, goal oriented behavior, um, thought diffusion. I know I'm
Yeah.
throwing out terms if anybody's not
Yeah.
familiar with them, um,
Yeah.
can be really beneficial when it comes
Exactly.
to managing a chronic illness.
Yeah, yeah. And I've even learned as I've practiced more and more the ways in which CBT can be adapted for chronic illness work.
Oh, yeah.
And, but ACT is always still going to be, I'm always going to move more towards like, well, you can't control that thought that just popped up, but you don't have to let it drive the bus. Um,
Hmm.
like we can have that thought, feel it, and not let it dictate your next behavior.
Yeah.
Um,
I
yeah.
love that. I might steal that from you.
Yeah. I
That
mean, I
wording.
stole it from many ACT trainings, so
Yeah. Drive the bus.
yes.
Yeah.
Yeah.
Well, Destiny, I could talk to you for hours. And I
Yeah.
knew that was going to be it because we both are very passionate about that. But as we're getting towards the end and wrapping up, is there anything I haven't asked you about that you would like to touch on, or anything we started talking about that you want to expand on? Just like kind of final
Yeah.
thoughts on this conversation before, of course, I ask you all your socials and everything like that.
Totally. Yeah. I think we did touch on it a little bit, but I just think it's really important to talk about the intersection of finding good medical care and mental health support and
Yeah.
how both we did, but like how it really feeds off of each other.
Hmm.
Because, one of the things we both have also talked about is being bounced between providers, being
Hmm.
told, that they need therapy, but then told by their therapist that they just need medical care, and like nobody's actually coordinating or addressing the whole picture. So you really need both. And as much as you can get a therapist and a doctor who is willing to talk to each other,
Hmm.
that's like best case scenario.
Yeah.
But a good therapist who not like a morally good, but like a therapist who understands chronic illness can really help you process that emotional weight of living with something you can't change and developing coping strategies.
Hmm.
But they cannot replace medical care. That is
Yeah.
pivotal.
Absolutely. I love that. Well, once again, thank you so much for coming
Yes.
on, talking, sharing all your knowledge. As the last question I ask all my guests, where can people connect with you? And I know you mentioned at the beginning that you have some exciting things coming up, so feel free to plug anything you want to that you have coming up.
Yes, thank you. Thank you. Yeah. And so I have things for both people who live with chronic illness who are like not therapists, and then I have stuff for therapists and allied health professionals. But for non-therapists, I do have a membership. It's very low cost. It's $17 a month, and it comes with multiple support groups, a sex and chronic pain support group, a general support group, and a monthly workshop around something that I usually do with another licensed medical professional. So that's welcome to the waiting room. All of this is it's thechronicillnesstherapist.com/membership. Of course, I do one-on-one therapy for Georgia, Florida, and Colorado residents. These days, I do a lot of intensives, so people who have been in therapy for a while and they're just looking for like a targeted chronic illness one-on-one workshop kind of thing. I do that. And then for therapists and physical therapists, the conference is actually 13 CEs approved for both physical therapists, social workers, counselors, and certified rehabilitation counselors. And I also run a free consultation group every month for them. So lots of things. It's all on my website.
Awesome.
I'm redoing my website at the moment, so it's kind of a hot mess right now, but in April it will be finalized. So I'm really excited about that.
Okay. Well, I will link all of that. I'll link your website and
Thank
then
you.
I will also link the specific links since you just said it's a hot mess to help navigate, but I'll put all of that in the
Thank
show
you.
notes of this episode so people can find you and connect with you. So
Awesome.
thank you. I know
Yeah.
I've said that like 5 times already, but thank you once again so much for coming on and having this conversation. It was a pleasure talking to somebody that also does very similar work. I
Yes.
know we're in different settings, but it's always great to talk with someone that understands chronic illness and the intersection of chronic illness, mental health, medical trauma, all the things. And yeah, I just really appreciate the conversation.
I agree. Thank you so much for your great questions. It was a pleasure to talk to you.
And thank you, the listeners, for joining for today's episode of Psych Talk, and I will catch you in the next episode. Bye.
Thank you for listening to today's episode of Psych Talk. Please rate, review, and subscribe to the show. And if you enjoyed today's episode, please share it with a friend. Don't forget to follow me on all socials at Jessica Lee, PhD, and the podcast at Psych Talk Podcast on Instagram.